You know, chronic pain is one of the toughest problems in medicine. It's just so persistent and so hard to treat. So what if I told you that one of the most common treatments, a drug prescribed millions of times, might not actually be delivering a benefit that people can feel? Today, we're diving into a huge scientific review that puts the really surprising use of antidepressants for chronic pain right under the microscope. Let's get into what the evidence says.
First off, just to get a sense of the scale here, look at this number, $214.5 billion. That's how much is spent on healthcare every year in the US for just two conditions, back pain and osteoarthritis. I mean, that's more than we spend on almost any other single health problem. It is a massive issue, affecting millions and costing an absolute fortune.
So with a problem that enormous, you'd think we'd have some pretty rock-solid solutions, right? Well, that leads us right to the big question. What are we actually doing to help people manage all this pain?
And here's where things get interesting and maybe a little surprising. One of the most common treatments isn't a typical painkiller at all. It's a type of drug that was originally made for depression. Now, the idea here is that some of the same chemical pathways in our brain that handle mood also have a big role in how our nervous system processes pain signals. And just to be clear, this is not some fringe practice. This is totally mainstream. We're talking about 3/4 of the official clinical guidelines for low back pain recommending these drugs. In the US, they are the 4th most prescribed medicine for this kind of pain. And get this, over 1/4 of people with chronic low back pain are given a prescription for one almost right away, within just 3 months of their diagnosis. This is happening everywhere all over the world.
So, here's where we get to the heart of it. We have this huge problem, chronic pain, and a really common, officially endorsed solution. But the billion-dollar question, or I guess the $214 billion question, is when you gather up all the best scientific evidence, what does it really say? Do these drugs actually work for pain? And that's exactly what this major study, published in the British Medical Journal, wanted to find out. They decided to put all of the evidence under a powerful scientific magnifying glass to get the absolute clearest picture possible. So what is this magnifying glass? Well, it's something called a systematic review. Instead of running one new experiment, what researchers do is they go out and they find all the high-quality studies that have ever been done on a topic. In this case, that was 33 different trials with more than 5,000 patients. Then they pull all that data together to see what it says as a whole. It is honestly one of the most powerful tools in all of medical science.
Okay, before we dive into the results, we have to get our heads around one really important idea. There's a big difference between something being statistically significant and clinically important. Statistically significant just means the effect they found is probably real and not just some random fluke. But clinically important, well, that asks a much more practical question. Is the effect actually big enough for a real person in pain to notice it, to feel real difference in their life?
To make this super concrete, the researchers set a very clear standard. They used a pain scale that goes from 0 to 100. And they decided that for a benefit to be clinically important, it had to reduce someone's pain score by at least 10 points. So the question isn't just, did it help a little? It's, did it help by at least 10 points? Keep that number in your head as we look at the results.
All right, so here it is, the results in a nutshell. For back pain, a type of antidepressant called an SNRI did reduce pain, but the effect was small. It did not meet that 10-point cutoff for being clinically important. For osteoarthritis, it was a similar story. A small effect was there, but this time they said a clinically important benefit cannot be excluded. So it's a maybe. And for sciatica, which is that radiating nerve pain, the evidence for any antidepressant was just so uncertain they couldn't really draw any solid conclusions. And pay close attention to that last column, certainty of evidence. You can see it's only moderate at best, and for sciatica, it's very low.
So let's translate that into plain English. For back pain, the benefit is real, sure, but it's just too small to make a meaningful difference for most people. For osteoarthritis, there's a similar small benefit, and it's possible it might be big enough to matter, but the evidence is a bit shaky. And for sciatica, we just don't have good enough data to say one way or the other. It's a big question mark.
Okay, so knowing the benefits are pretty small or uncertain, well, that's only half the story, isn't it? When you're making any kind of medical decision, you have to weigh those potential benefits against the costs. And in medicine, the costs are usually side effects.
And the data on side effects here is pretty clear. The review found that people taking these SNRI antidepressants were quite a bit more likely to have some kind of adverse event than people taking a placebo, a sugar pill. We're talking about 62.5% of people on the drug reporting a side effect compared to just under 50% in the placebo group.
And if you want a number that really hits home, check this out. People taking these antidepressants were more than twice as likely to actually drop out of the studies because the side effects were just too much to handle. And that tells you something really important, that for a lot of people, whatever small benefit they might have been getting was completely outweighed by the downsides.
So what's the big takeaway here? The study authors said it best themselves. The point of this research isn't to say stop prescribing these drugs. Not at all. The goal is to give doctors, and especially patients, all of this information, the small benefits, the shaky evidence, the real risk of side effects, so that they can sit down together and make a truly informed decision.
And all of this leaves us with a really big fundamental question. What this review shows is a pretty wide gap between a very common medical practice and what the science actually says. It kind of forces us all to ask, when a treatment's benefits are this small and the evidence is this uncertain, how are we supposed to decide what to do? It's a tough question, and it's one that every single patient and doctor has to grapple with.